A family in Deschutes County says the community crisis response team failed to help their son in a time of need. Isabella Warren has our special report on what went wrong and what the family's demanding.
The brain is just as fragile as a broken leg, and just having that awareness of like, we're going to meet this person where they're at. We're going to stay calm, which they did stay calm in this situation. I think that if Deschutes County crisis team, if they had been able to show up sooner, we could have avoided all of this.
It took Deschutes County Community Crisis Response Team nearly 2 hours to respond to a mental health crisis that happened 2 weeks ago. Now, the patient's family is demanding change. According to his mother, a 22-year-old man was experiencing psychosis on the south side of Bend when police and the CCRT were called for help. But the situation was escalated once officers arrived on scene.
They went in, kind of handled the situation. This person was in serious psychosis, like to the point where afraid, not understanding what's happening, very agile, frustrated. So that put under in handcuffs. And then the family and me stood back just to kind of gauge what was going on, trying to diffuse the situation.
In a statement to News Channel 21, the mom said the continued poor response by mental health services will cause more harm than good, like what happened with her son. This story is just one example of numerous we were told by people in the community, but each story continued to have one thing in common: response time.
From February 1st through February 16th, I think is the cutoff date that I picked, because it seemed like most of our entries were in. Our average time between dispatch and arrival was 27.3 minutes. It does depend on a variety of factors. We've been hit with a lot of snow in February. So weather can be one of those factors. Staffing, as we mentioned, can be one.
The crisis team supervisor says no call is the same, and response times can vary based on the nature of the situation. If police believe the environment would become more aggressive with team members there, the team will be called off. The teams of 2 and 3 usually cost about $2 million, and last year, over 1,000 calls were answered.
That's ultimately our whole goal of expanding crisis services, is how can we connect people to the service they're actually needing and the right level of care for whatever's going on for them without having to send them to the hospital or having them end up in jail as a result of their crisis.
The patient is currently being treated at St. Charles for his psychosis, and it's unknown when he will be released. Isabella Warren, News Channel 21.